Hello, I'm Dr Annalene Weston, Dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at the key dental legal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. Now, we're going to be rolling out a mini-series within RiskBites this year called The Tipping Point. These case discussions are intended to identify and explore that moment in time where a patient moves from being a disgruntled patient to actively becoming a complainant. And conversely, of course, is it possible that there's a moment in every case when, if handled well, we could potentially avert an impending complaint? Now, in this edition, we wanted to take the opportunity to walk through a case from the Dental Protection Vault, which we thought may give some food for thought when we consider how we initially engage with patients when dealing with complaints. So I'm joined by my colleague, Kristin Trafford Wiezel, who's one of our case managers at Dental Protection. So hello, Kristin.
Hi, Annalene. Thanks for having me.
Thanks for being here. And we're going to step through one such situation, aren't we, Kristin, which could have gone in either direction. So in the first instance, let's walk through the particulars of this situation. So what actually happened in the lead up to this particular practitioner receiving a complaint?
Okay, Annalene. So I'm going to set the scene. Mr. A was the patient in question, and he was on holidays in beautiful North Queensland enjoying the sun and natural wonders. Unfortunately, however, when Mr. A was having lunch, he did break one of his front teeth and had to make an unplanned stop to the local dentist. Mr. A booked his appointment with Dr. X, who is a general dental practitioner, for an emergency consultation. Dr. X assessed Mr. A, conducting all the relevant special tests, and discussed their findings. Sadly, the results identified that along with a large restoration being required, Mr. A's lateral incisor had a periapical radiolucency and required root canal therapy at some stage to address this chronic infection. So Dr. X discussed these options with Mr. A, including do nothing, a restoration to restore the aesthetics, especially while he was on holidays, followed by commencing root canal with his regular treating practice when he got home, or a restoration to restore the aesthetics and actually commencing the root canal therapy with them, or lastly, obviously, extraction.
Yeah, this is a horrible decision to be making on holiday.
Yes, indeed they are, Annalene. And understandably, Mr. A was not in favour of either of the options of either do nothing or extraction. So on consideration of the alternatives, and as he's not experiencing any symptoms, Mr. A elected with option 2, which was a restoration and to return to his regular treating practitioner when he got home. So Dr. X completed the restorative treatment that day, which was quite significant due to the size of the fracture. Unfortunately, from Mr. A's position, the appointment didn't go particularly well, with composite being dropped in his mouth, instruments being dropped on the floor, and what he felt was some pretty excessive social chatter between the dentist and assistant, and a particularly traumatised and bleeding gum by the end of the appointment, exacerbated by his blood thinning medication. So on completion, Mr. A was then issued a very large invoice. However, settling the count was impeded due to an error with the treatment coding, and they required Mr. A to pay in full, and then he had to attend his private health insurance and then return back to the practice to have a portion of his payment refunded. So understandably, all of these added additional layers of frustration to an already stressful situation.
Gosh, it can be really difficult when everything feels like it goes wrong at once. And it's often in these appointments too when you're fitting in an emergency.
Yeah, that's right. I equate it somewhat to when you're running late and then you get every single red light and a pedestrian crossing.
Yeah, every school run.
So now, on returning home from holidays, Mr. A indeed did return to his treating practitioner, as on top of everything else, Mr. A wasn't actually all that happy with the aesthetics of the restoration that had been placed. Though, as he believed that it was somewhat of an interim measure, he'd hoped that this could be easily rectified. Mr. A then suffered a number of additional surprises that the restoration he was unhappy with needed to be entirely replaced, which was, again, a significant cost, as well as receiving the treatment plan for the root canal. And this felt like the final straw for Mr. A, who contacted his local health complaints commissioner, concerned that though mishaps occur, for them to all occur simultaneously in one appointment, that perhaps it was an indication that both the practitioner and the team were somewhat incompetent. So the Commissioner provided some advice that in the first instance, his complaint should go directly to the practice or the practitioner for them to see if they can attempt a resolution.
Yeah, that's fabulous, isn't it? I mean, it's always so much more preferable to deal with the patient directly to resolve things, if at all possible, rather than have it escalate so quickly up the food chain unnecessarily.
Yeah, I think so too. Though I can appreciate it likely doesn't feel like a good thing when you actually receive a complaint from one of your patients.
No, it doesn't. And it can certainly be a difficult path to navigate well, though, of course, we're absolutely here to help.
So this situation was no different. Mr. A subsequently wrote a letter to the practice requesting a justification for what he felt was an excessive cost for a temporary treatment, as well as an explanation on the list of mishaps that had occurred throughout his appointment. Understandably, Dr. X was pretty upset on receipt of this letter, suggesting that they were incompetent and asking for a please explain. As we just mentioned, complaints can be a difficult path to navigate, especially when they can feel like a bit of a personal attack. It can really awaken those feelings of frustration or anger, especially when they appear to be out of the blue for us, and to top it off from a patient that we perhaps may have thought we'd gone the extra mile for, or fitting them in our lunch break and doing the best we can to help them. So these feelings can result in a less than ideal off-the-cuff response that may not particularly help the situation.
Yes, often our emotional response isn't our best response. So hopefully Dr. X acknowledged that they may need some assistance in responding, and they contacted Dental Protection first.
Yes, thankfully they did. And the team at Dental Protection looked over the particulars of the situation and helped to talk through the options in responding to Mr. A's concerns.
Yeah, I'm so glad. In times like this, where it's upsetting for an individual, it can be really helpful for them to have someone in their corner who can look over things from all perspectives. By not being in the middle, experiencing it personally, that third party, in this case, us, can offer insight and offer impartial advice on how to resolve things in your best interest, as well, of course, for the patient.
That's right. And though Dr. X did not personally agree with a number of the points brought up in Mr. A's letter, Dental Protection worked with Dr. X on their response, which took time to acknowledge Mr. A's concerns and responded very comprehensively and thoughtfully. Though not necessary, Dr. X's response also offered a small portion of Mr. A's out-of-pocket expenses to be refunded as a gesture of goodwill, in acknowledgement of his dissatisfaction of the aesthetics and the replacement completed with his usual general treating practitioner.
So how did things end then, Kristin? Did Dr. X still end up with an OHO notification after all of this?
Actually, this is where the true benefit of engaging with our patients and listening and hearing their concerns and responding with empathy really comes to light. So in this situation, though the patient was fully ready to lodge an official notification and had actually contacted them, surprisingly, the patient's response came back with a completely different tone. It acknowledged how appreciative he was for the time that Dr. X put into their extensive and thorough reply, backtracking on the insinuation that Dr. X and the team were incompetent and acknowledging that everyone has an off day. Additionally, Mr. A declined the refund personally and simply asked for the nominal amount to instead go to a worthwhile charity of Dr. X's choice, and wishing them all the best for the future.
Yeah, this was quite a turnaround. I remember this case actually, and it felt like such a win because we had a patient that was so primed to make a complaint, and then to turn around and say, thanks so much for the explanation, and I don't want your money, was actually, it felt lovely, didn't it?
It really did. And it's just a testament to the way that we behave actually can make such a fundamental difference on how things progress. And ultimately, though people can be upset, sometimes what they really want is to be heard and to be taken seriously. So engaging with them, even if you think the issues might be minor or that you don't agree with them, it can really go a long way in the eyes of a patient, and additionally in the eyes of our peers and the regulator. So it makes me feel pretty good also when I know that I've taken the time to listen to my patients and we've got a really good result. And hopefully Dr. X felt the same way too.
Yeah, it was such a great outcome, Kristin. And it's wonderful when we can work with members to help them get such a fabulous result. So as we can all see from this matter, there most certainly is a time or pivot point where what we say and what we do can tip the balance on how things proceed. Communication and our conduct can be key. I feel like we say this all the time. We'll be mentioning records next. No, but we do know from previous research that complaints relating to adverse outcomes and treatment only make up about half of the complaints to the regular, with the other half being based in things like communication.
Yeah, that's right. And how we behave and how we listen and how we engage with our patients when things go wrong can really be the litmus test for what kind of professionals we are. However, it can be hard. And that's why you have us at Dental Protection to assist in navigating what can be a pretty difficult path to get the best outcome from everyone.
Yeah, indeed. Thanks, Kristin. And thank you all for joining us today. And we hope that you found this content relevant and helpful. And we look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.